In order to solve the problem, one must understand the root cause. And in any root causes, there are some players. So this lecture, I'll explain to you who are the major players in USA healthcare system. So the first one I can think about as far as the stakeholders, it's going to be consumers. The second one I'm going to say providers. Third one I'm going to say suppliers. And I'm going to say one more stakeholders, others. On this side, I'm going to write down federal government and then state and local government. And there's one more stakeholders, which I'm not going to say right now, but I'm going to say companies. And I'll explain to you in the end, okay? Now, who are the consumers? Let me change the color here. The consumers are you, me, your family, my family, and others. Others who live in USA. Providers are, which you already know about it. These are the providers. When you get sick, you go to the doctor's office, right? Before you go to doctors, you visit nurse practitioners. And if you are very sick, you end up visiting hospitals. And I'm pretty much sure you must have done lab tests. So these are the healthcare service providers. Suppliers are the one who are supplying or supporting the providers. So I'm going to say pharmaceutical company, medical instrument companies. So these are the suppliers who are supporting healthcare providers. Actually, let me correct here. The pharmaceutical company should be as a providers, and these are the drug companies. Okay. Now others, you can put down others as let's say anytime you start business, you need to make sure that you have business insurance, right? And then I'm going to add one more here, med school. Sorry, sometimes I type fast and I do make spell check mistakes. Okay. Now let me walk you through an example here. Oh, I forgot one more. There's one more stakeholder here, and that is employers. How could I forget that? You know, more than 40% of the medical health insurance is being supported by employers. Okay. So let's say the name of this employer is ABC Corp. Okay. Let's give one more example. Your mom is working for this employer ABC Corp. So your mom is expected to pay state tax, federal tax, and she's also expected to pay Medicare tax. And I'm going to write down here 1.45%. Okay. Oops. Likewise, the employer is also expected to pay payroll tax, and Medicare tax 1.45%. Okay, let me rearrange this. Okay, there you go. Now, if the employer is generous, the employer may offer benefits, and one of the benefit is healthcare insurance. Now, chances are that your mom may be sharing this healthcare insurance. So I'm going to say medical insurance has been paid by or co-paid by your mom also. I'm not going to say co-paid, it's shared by your mom. So the employer and employee sharing this medical insurance premium cost, okay? So now, let's just try to make sense out of here. I'm going to write down two programs here. So I'm going to mention something new, which you may not have heard about it. One is Medicaid, and another one is Medicare. And I want to make sure that I put this Medicare under federal. And the Medicaid, I'm going to put down between state and federal. I have dedicated 2 special lessons on Medicare and Medicaid. But on a high level, Medicare is the program. It's a healthcare program. It's supported by federal government, and that's for anyone above 65, so for seniors and some disabled people. Medicaid is it's shared between state and federal government. This program is supported by state and federal government, and it's meant for people who are eligible under federal poverty line, and I'll explain to you later on. So the mysterious stakeholder is healthcare insurance companies. In order to understand how these stakeholders they work with each other, and mainly how the financial transactions are done, let me walk you through an example. Your mom pays state, federal, and Medicare tax. The company she works, ABC Corp, pays payroll and medical tax. Now, as a consumers, you work with the service providers. If you get sick, go to doctors, visit hospitals, do the lab test. Now, as a consumers, you are also working with health insurance company, and like I explained before, that your mom may have medical insurance from the company she works, and the medical insurance and your mom sharing the cost of medical insurance premiums. Okay, so going back to example that you visit the doctor, and doctor prescribes the lab test or prescribe the drugs, you buy it. So every time you visit the doctor, lab, or pharma, ultimately you have to work with health insurance company. And the suppliers, they work with service providers. And then business insurance need to make sure that service providers are covered from their business point of view. The med schools are not cheap. Doctors pay a significant amount of tuition fee. I'm going to put down some numbers, and don't quote me for that. Let's say 200K to, let's say 400K. It's expensive. Okay. So now, coming back to Medicare tax, the Medicare tax paid by your mom is 1.45%, and Medicare tax paid by ABC Corp is 1.45%. Total 2.9% of tax goes to Medicare, and the Medicare, as I explained before, that this is the program run by federal government for anyone about 65 and some disabled people. And we'll go over this Medicare program, details of the Medicare program later on. Now let's shift our focus on how health insurance companies works. So health insurance companies' main business is to provide and sell health insurance plans to consumers. Okay. So in our example, your mom was working for an employer and your mom share the plan, medical insurance plan, and then gave the premium to health insurance company. But there are many consumers, they go directly to health insurance companies. Okay. Now let's just learn about health insurance company. I want you to learn three things: deductible, co-insurance, and copay. So what's deductible? This is the amount you must pay before your insurance coverage starts. So for example, deductible is $2,000 and your bill is $2,500. So you must pay first eligible $2,000 expenses, and rest of the money, it will be paid by your insurance, and you still have to pay as a part of co-insurance. So what's co-insurance? So co-insurance is your share of the healthcare cost which you must pay after your deductible is over. So for example, if your plan pays 80% co-insurance, you are responsible to pay 20%. A typo here. Co-insurance. Okay. Now, what's the meaning of copay? As a patient, when you go to doctor or hospital, you must pay a fixed amount, and that depends upon the plan. I mean, you must have seen that many times when you visit to doctor, your mom or your parents, they give the medical insurance card and then give you the credit card or check or cash, and that's a fixed copay. So sometimes the copays are $10, $15, $25, depending upon your plan. So again, don't get confused next time you hear about deductible, co-insurance, and copay. So let's summarize what we have learned. There's an obvious conclusion here I can derive here is that there are too many stakeholders when it comes down to US healthcare systems, and inner relationship among these stakeholders are too complicated. Drug companies, health insurance companies, they are often publicly traded multi-billion-dollar companies, and often their interest is the bottom line, make wealth for their stockholders or key investors. Okay. So next lessons we'll learn about how this US system is creating issues for patients and consumers. We'll also learn about Medicare and Medicaid, and after that we'll learn about what's the impact of this expensive, complicated USA healthcare systems. And the last lesson we'll talk about the solutions, that's my favorite, solutions to fix this USA healthcare system.